the walls of the bone do not have pain fibers in them. The surface does. And inside the marrow cavity, we have pressure sensors. So if we draw a lot of bone marrow out at once, or let's say you inject into it a large volume at once, that'll hurt. Your patients will feel that pressure change. But the way we do it, it's different than a marrow biopsy. So first off, I use ultrasound and we guide a needle and I anesthetize the surface of the bone. We have pain sensory fibers on the surface of the bone, but not in the walls of the bone. So I numb up the surface of the bone, and then we have the IV going, and I use what's called a bone trocar. So if you imagine like a thick needle with a handle on the edge, with a sharp needle inside of the needle. That's what a bone trocar is, and that needle is about as thick as the base of this pen. So, and it's about this long, and so it has a handle on the end. So I guide with ultrasound down along the crest here and just manually kind of bore into the bone. And once I get in, I can feel a pressure change that I'm in the marrow cavity. And then I pull out that central sharp tip and put a syringe on the end and aspirate a little bit of bone marrow, like 6 to 8 ml of bone marrow. And then change the direction, repeat that, and then I advance it a little deeper, like ½ centimeter deeper, and do that at 4 different depths on each side of your pelvis to get a total of about 120 ml of bone marrow, 60 from each side. So when I draw small amounts, there's a small pressure change and you don't feel the pain. Patients hardly can even ever tell what I'm doing. Whereas when you do a bone marrow biopsy, or there are other regenerative clinics that do this and they'll draw it all from one spot, and that hurts. Well, we don't do it that way because there's numerous research studies showing when you draw small amounts from multiple locations and different depths, you get the highest number of live stem cells by taking little bits. When you draw it all from one spot, you get much more blood and less of the stem cells.